Hi, my name is Dr. Seng. I'm a senior medical oncologist from OncoCare. Today we're talking a little bit about lung cancer. Let's start off with some simple questions, then move on subsequently to some of the most pressing issues about lung cancer nowadays. Lung cancer is generally a malignant growth arising from the lung of patients. They are generally made up of two types, namely small cell lung cancer, which makes up about 15% of all the lung cancers in Singapore, and more commonly a non-small cell lung cancer, made up about 85% of all the lung cancers in Singapore. The focus of discussion today will be mainly on the more common subtype of the non-small cell lung cancer, which are further divided into three common types instead of a squamous cell carcinoma and adenocarcinoma. There are other rarer subtypes, but that will not be the focus of discussion today. Patient with suspected lung cancer will require a further evaluation by a doctor or specialist. This will require the evaluation by taking a more thorough history taking and also physical examination. Biopsy will be required to confirm the diagnosis of lung cancer, and this can be achieved via two methods. Number one of the options will be that of bronchoscopy, using a camera tube to go through the patient's throat, eventually into the lung of the patient, and depending where is the location, the biopsy can be performed. The other option, alternatively, would be to consider a CT-guided biopsy, requiring a needle through the chest wall directly into the lung nodule to do a controlled biopsy. Once the diagnosis of the lung cancer can be confirmed, the subsequent management will require a few imaging to confirm the stage of the patient. This will impact on the subsequent management of the lung cancer. For the early cancer in the stage 1 or 2 situation, the treatment of choice will be that of a surgical removal of the cancerous nodule. In a selected patient with a high-risk feature, for example stage 2 disease, will require some form of post-operation adjuvant chemotherapy. In a patient with a locally advanced disease who are not a candidate for surgery, the treatment of choice will be that of a concurrent chemotherapy and radiotherapy. In suitable patients, usually this will be followed up by 1 year of immunotherapy. This has been shown to improve survival for patients in this setting. In some patients, when the lung cancer is diagnosed in more advanced stage, where the cancer has spread to other body parts, there are several treatment options available. And in this day and age, it should be highly personalized to individual patients. All the cancer cells will require some form of a genetic testing, namely EGFR, ALK, ROS1, PD-L1, and also BRAF2, identify a patient or subgroup of patients that would be beneficial from targeted therapy. There are two forms of treatment at the day and age, namely oral targeted therapy and also immunotherapy. In patients with activating mutations, as highlighted earlier, they should be suitable for oral targeted therapy. And this form of treatment has been shown to be more effective than the conventional chemotherapy. And more importantly, the side effect profile on using oral targeted therapy are much lower compared to conventional chemotherapy. And that would improve a patient's quality of life while on treatment. In patients who does not harbor genetic mutation of the lung cancer, a new treatment approach has been finally approved, and is in the concept of immunotherapy. In recent years, immunotherapy has been voted under the prestigious clinical trials journals to be the breakthrough treatment for lung cancer. More importantly, a Nobel Prize last year in 2018 has been awarded for 2 scientists who developed and discovered the role of immunotherapy in the treatment of lung cancer. In this combination of treatments, multiple patients have benefited, and it has been shown to be superior compared to conventional chemotherapy and largely have a lower side effect profile compared to the